Hello, I'm Dr. Rostenberg, and I want to personally thank you for checking out my YouTube channel. Stay tuned at the end of the video, and I will give my recipe for your healing process. Now, I wish we could achieve our results with just diet and lifestyle alone, but supplements really do make the difference. And to help you with that, you'll have an opportunity to order supplements at a discounted rate. We'll see you then. What I want to share with you tonight is a big part of our practice, and it's a big issue in our culture called, small intestinal bacterial overgrowth, and we call that SIBO for short. So anybody in this room not heard of that acronym or that name before? Everybody's here because you have. That makes sense. So that's what we're going to do. We're going to solve SIBO. As I like to do in these talks, I like to look at the big picture before we get lost in the details. But this is new research from the Mayo Clinic. This was published in PubMed this year. And only 3%, 2.7% of adults in the United States are healthy. What does it mean? How did they define health? There's just 4 factors: physical activity, healthy diet, non-smoker, and ideal body fat. Okay? Those are the only requirements to get yourself into this category. And unfortunately, 7.3% of the population does not meet that criteria. So we have a lot of work to do, just as a group. As a 300 million strong country, we got to do some improvement on this. So this is your average person. This is your average teacher, firefighter, son, daughter. We have health issues, and we need to learn everything we can to improve our health. And luckily, naturally based therapies have a lot of effect. So life expectancy, and again, I'm always kind of keeping my ear to the ground for, information with shock value. But since, basically World War I, we've seen an increase in lifespan. We've seen sanitation improve, running water. We don't, poop in the same. We don't poop upstairs inside the house we live in. We don't go to the outhouse. We have plumbing, and we have a lot of things that increased our lifespan. Better nutrition, better food sanitation, refrigeration. All these things increased our lifespan. Antibiotics. But we've reached a point where no amount of technology, money, nanotechnology, computers, and medicine is actually increasing our life expectancy anymore. So the life expectancy now is cresting, and it's statistically dropped a little bit from year to year. And that's never happened since, like I said, World War I. So is it just a blip and a momentary pause? It might be, but it might be the indicator that as a collective, we're not addressing our problems adequately, and the toxins in the food, the genetically modified food, and all the things that are affecting our health are starting to catch up with us. So I take it as a wake-up call. Hey, you can live with regret, or you can live with discipline, and discipline tastes a lot better in the long run. Definitely does. And again, just more on that idea, we've reached a tipping point where the researchers from Harvard don't believe that any more technology is going to extend our life. So if it's not a $500,000 medical procedure that's going to add 3 years to our life, maybe it's something a lot simpler and a lot more basic and fundamental that will actually do the trick. All right? So that's what we're going to learn about today. And then just a little bit on the same topic here. Malnourishment, we tend to think of someone who's starving as someone with that bloated belly, really skinny, lean, starving child. And there are certainly people in the world who are starving, but researchers now estimate that 1/3 of everyone in the world is malnourished, which is a different story than just not getting enough calories to live. We're getting plenty of calories, but we're not getting enough nutrition. And this may show up as obesity just as much as it shows up as weight loss or not, losing weight. So many people who are overweight and can't lose weight are in fact malnourished. Not from a calorie point of view, but from nutrition, from vitamins. And it takes vitamins to burn fat. So we eat a lot of sugar, eat a lot of processed food that doesn't have nutrition in it, then you lose the ability to burn that fat for energy, so it just gets stored. This is the world that we are working on and inheriting right now. So speaking of inheriting the world, we're going to talk a little bit about how we come into the world. because this is where our gut health starts, literally, how we're born. All right? For generations upon generations, for thousands of years, women gave birth vaginally, and the baby was covered with bacteria in the nose, in the mouth, and all over its skin, and that sets up for the health of the child for the rest of its life. Now, cesarean sections, we're lucky we have them because they save babies' lives. Absolutely right. But now they become an elective procedure, and in some parts of the country, 30 to 40% of all pregnancies end in C-section. So what they're robbing their children of is the bacterial transfer that sets the stage for the rest of their life. And so this is just I'm actually going to go up one slide and then I'll jump back. So this slide just gives you a visual to get your eyes wrapped around. This is the scientists using different colors to represent different kinds of bacteria. I mean, there's thousands and thousands of different species. So it can be very different from one person to the next, from one family to the next, from one part of the world. But just taking the same European type of individuals, a vaginally born breastfed baby, you can see the complexity and the growth of their bacteria after a year. Vaginally born bottle-fed, different kind of bacteria. C-section, different altogether. When a baby's born C-section, you're looking at a virgin blank slate. There is nothing growing on the baby. Whatever it comes into contact with starts growing right away. So whether it's something on the nurse's hand when they grab the baby, on the nurse's glove when they take it over to weigh the baby, something in the hospital, it could be anything that you come into contact with is going to set the stage and seed this child for the rest of its life. So that's just something to pay attention to. Now, I have in another video about healthy pregnancy, I've shared, there's a technique if a baby has to be born C-section, what the husband should do is take sterile gauze and a sterile urination collection cup and put gauze in there and soak the gauze with sterile saline solution, like contact solution. And before the C-section, 45 minutes, put the gauze in the birth canal and let it stay there for half an hour. Take it back out, put it in the urine cup, close it. Baby comes out, and the first thing you do is wipe that gauze all over the baby. And I happen to have a child who, maybe he'll grow up to be a more stubborn boy. I don't know. But he wouldn't turn over, and we did everything we could, and we weren't able to flip him, and he was breached at 8 centimeters. So, you're going to have a C-section at that point, and because it's really dangerous for the baby. So he came out and we covered him with bacteria the way I just described. No eczema, no allergies. A lot of these children who are born C-section end up with that. So there's average ways to do things, and then there's better ideas. And doing the vaginal bacteria transfer is a really excellent tool for anybody in your life who's going to have a C-section. And so then we look back at this slide just showing you that, okay, how you get into the world is important. So let's say the baby's born, it's a sterile environment. This is where all of our gut bacteria come from, is how we're born. That's where it starts. And so, through breastfeeding, there's bacterial transfer, there's contact with the skin, and then vaginal, obviously, like we just talked about. So a mom who has a lot of dental mercury, that actually kills some of the bacteria, and that mercury is passed on to the baby and affects the baby's biology. Then you have bottle feeding. Again, human breast milk is the perfect food for babies, and formula keeps babies alive. Milk's best. And then you have overbathing. I mean, sometimes you don't use soap. Just gentle bathing on these kids because you'll pull the bacteria right off. And then early life antibiotics and C-section. So just stuff to think about. When I work with patients who've had really tough gut problems, one of the things I always ask them is, what was your birth like? I mean, were you born C-section? Were you bottle-fed, breastfed? Because it helps us understand how long have they had this compromise. Was the person fine until they were 43? They got herpes and the doctor prescribed antibiotics for 10 days, and then they got a horrible gut infection and their hair started falling out. We should never give antibiotics for herpes because it's a viral infection. So that was, they got mismanaged, and then boom, 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 all these problems started from that. Or did they have the problem from a young age? So, young age, frontal lobe development, and bacteria. So this is another research article from last year, 2016. And it's basically saying that, okay, the gut bacteria affect how fast our frontal lobe grows with the myelin sheath around our white matter, okay? So what's living in our gut affects how fast and the nature of our frontal lobe development. So they find in autistic children, 99.8% of autistic children have very dysfunctional and imbalanced gut bacteria. And we know that you can't exhibit autistic behavior without having frontal lobe changes. Conversely, fixing and helping children with their frontal lobe alleviates those symptoms of, spectrum disorders. So it's like the gut affecting brain back and forth. But here's 20 years old, right? So this is a male brain, and you don't give kids gasoline and matches. They're not gonna. They don't have the judgment, the prefrontal cortex to know the consequences of their actions, right? But as we age, that develops, and by the time we're 20, this might be a female. I think that males actually don't get full maturity of their frontal lobe till they're 25. So it takes a little longer to fill that in. But just great new research. What literally is growing in your gut affects your frontal lobe in your brain, and I think the research will just continue to tie that in for us. So now we're going to, taking the idea of how we're born, a sick society, how are we born? Are we born in a way that gives us good bacteria or not, or are we born in a medical intervention that robs us of that? Bringing us now into the topic of tonight, which is going to be, small intestinal bacterial overgrowth. And you're thinking, okay, well, isn't there supposed to be bacteria in our small intestine? Well, yes, there is, but not nearly as much as in the colon. And so in the name, it tells us about the problem. Small intestine tells us where it is. Bacterial overgrowth tells us what it is. So this is a foreshortened version of our gut, right? We know that our gut is folded and it's 20 feet long from the stomach to the anus, 23 feet, depending on how you look at it, right?
Sorry, how long did you say the small intestine?
Well, the colon is 6 feet, and then so I would put that at about 18 feet total. Small intestine, yeah.
Oh, okay.
The surface area of our gut, I don't have the slide here, but this was published in 2014. The surface area of our gut is 1/2 of a tennis court, okay? So when you take a probiotic capsule and you open it, imagine opening it on a tennis court and trying to spread it around for half the surface area. So sometimes your dosing and how much you take of something matters. But basically the big idea is this. It's very simple with with SIBO. The bacteria that live in the colon and the bacteria that live now down near the colon are not kept in check, okay? They crawl up towards where the food is coming from, just like any organism would. You're going to go where the jobs are, where the cost of living is low, the weather is nice, and you can raise your family and have a nice life. Well, your bacteria is going to do the same thing if they're not kept in check, okay? We have 5 factors. 5 important factors that we'll go over here shortly that keep our gut in check. I'll wait till that slide. But we have self-defense mechanisms. We have things that create homeostasis, that create balance for us, that prevent SIBO from happening. So when we notice or recognize that someone has SIBO, I will go through these 5 factors and think all of these factors must be dysfunctional, or at least 3 or 4 of them, in order to allow this to happen. But you could have constipation, and you could have diarrhea, and you can have gas and these other symptoms. SIBO is very diverse in its presentation, right? It's wintertime, people get the gut bug, they vomit some and they get diarrhea. At least my kids do at school, that's what happens. That's a different type of a problem. That's a virus that goes through your gut. But SIBO is usually a problem of organisms that are supposed to be there, but they're in the wrong amount. Not enough water, and we're not going to do great because we're going to dehydrate. Too much water, same problem. It's all about the balance. So we want to have enough bacteria, and the prebiotic foods are fantastic. The kombuchas and the vinegars and the fermented vegetables and the Jerusalem artichokes and all these things that have prebiotic fibers are wonderful foods. But in this population, they may not make you feel good if this is your problem, because you're throwing fertilizer into a thick patch of bacteria that's already overgrown, and you need to go in the other direction. So if you're out there, one of those people in this room maybe, or further out, that has a bad reaction to onions, garlic, vinegar, kimchi, kombucha, sauerkraut, if you're having a problem with those fermentable foods, then this is a likely problem. I found this study recently, and I just thought it was, I love finding things that we see in our everyday life that can help us connect dots to things that are harder to uncover. But in this study from Sleep Medicine in 2011, right? So I've only found this study maybe for the last 2 months. It's changed my perspective on restless leg syndrome. 70% of everyone in their study with restless leg syndrome has SIBO. All right? So you have SIBO until proven otherwise if you have restless leg syndrome, right? And it may be higher than that, 70. But 70 was, this is the gold standard lactulose breath test. So they're doing the gold standard testing to determine that that's the case. So it's just fascinating to me. So many, as you'll see going through this process, a lot of the symptoms we deal with that don't seem related to our gut are. And if you recognize that SIBO, the problem with SIBO, I mean, what's the problem with too much bacteria? What would anyone wager a guess? I mean, what would be what's a problem of having too much bacteria in your gut?
Flatulence, diarrhea, all these symptoms you've already mentioned, because you said it was for many different symptoms.
Those would be uncomfortable to have to live with, for sure. But it would be that the bugs are eating dinner before you eat dinner.
Oh, nutrition.
Right? So we talked about a third of the world's malnourished. Only 3% of people are healthy. It may have a lot to do with the fact that we don't absorb what we put in our mouth. So what you choose to eat is huge, but what you absorb is a different story. And I meet some people who have the absolute world's perfect diet and they don't feel great until they start to fix these things, okay? But this is a fascinating concept to me that, you know, I studied celiac disease long before I looked at SIBO. And I recognized, of course, celiac disease destroys the lining of our intestine. It destroys the surface area. So maybe a healthy person has half a tennis court, but someone with celiac disease has a guest bathroom's worth of surface area to absorb from, okay? Drastic difference. And it's that surface area where you get your nutrition from. But what they found in SIBO was that some of the species that are in our gut, if they overgrow, they wipe the villi down because they release toxins and it just damages it. It mimics tropical sprue, which means it mimics celiac disease. So yeah, you can have malabsorption just by this mechanism because it damages your intestine and because the bacteria eat everything you're eating. Not fun. This kind of whole concept about SIBO originally got my attention because I love looking at genetics and B vitamin pathways, and it was another interesting thing about it is that it totally imbalances your B vitamin levels inside your body. And I was like, how does your gut problem do this? So this is the clinical manifestations. This is, you know, hey doctors, this is what you should look for in someone who has SIBO. Now it shows weight loss. That's a very common problem. Fatty poop because you're not absorbing fats, greasy stool, and then vitamin and mineral deficiency. And you get, you know, all the fat-soluble vitamins. I see low vitamin D consistently. B12 and iron, a lot of anemia, and all of these things. If we didn't even talk about anything else on the slide, just those right there are enough to make you feel pretty poor. People who are anemic have a lot of fatigue and they may have aches and pains, they can't exercise. You know, they're just not going to be robust because they're not getting great oxygen. But then you get excess folate. I'm like, how does this work? You get deficiencies of some vitamins and excesses of others. So I chased down this rabbit hole for a while and realized, and this is all peer-reviewed literature that I have on other videos, but too many bugs in your gut are pooping out folic acid and folate. So some bugs poop out B vitamins, which is great. We eat fiber, like the stalk of a broccoli. But the bacteria that are healthy eat the broccoli stalk and the fiber, and they poop a vitamin for us. That's a win for us. But if you have 10 times too much of that bacteria, now you get all this B9 in your body and low B12. Things go wonky. A lot of anxiety, insomnia, pain, a lot of high adrenaline comes from this because folate is rocket fuel for a lot of your biochemistry. But it needs the other components along with it to be balanced. So this is just one of the consequences of of SIBO. So we start to look at the gut differently now. We don't think about it as just, you know, do you have constipation or diarrhea? Like, how does your gut affect your chemistry? Again, just another slide kind of highlighting the other deficiencies I talked about. So the 5 causes, I mentioned this earlier. These are the reasons why people get SIBO. Okay, after working with, you know, hundreds of patients who've had this problem. This is the story, and it's usually all 5 of those at once. So you have antibiotic exposure via food and medicine. Now I wrote that food and medicine intentionally. So what's the number 1 GMO toxin that they're spraying on food? Roundup. Excellent. And anybody know what the active ingredient in Roundup is? Glyphosate. And you'll see here shortly, glyphosate is patented as an antibiotic. So they're literally now spraying antibiotics on the food. It's insane, you know? History will not judge us with the kind summary of what we're doing there. Now we have hiatal hernias. Who here has not heard of that? Great, we'll get into that. I love talking about hiatal hernias. It's a huge problem, huge, massive, not looked for, not understood how to treat, and goes on for years and it probably puts people in psychiatric hospitals because their stomach's in the wrong place, and I'll show you why. Poor blood sugar, yeah. Everybody is susceptible to this, you know, worrying about the election or the weather, skipping meals. You know, even if you eat healthy, let's not even talk about that large group of people who are, you know, drinking several Diet Cokes a day and eating, you know, Christmas cookies for 5 months after Christmas. But let's talk about people who even eat healthy. I mean, if you don't take time to kind of pause and eat your food and eat enough calories and eat frequently enough, you start to create chemical changes in your body that shut off digestion. So if you have to fast, and fasting's healthy, okay? There's a lot of discourse in the internet world about, you know, you should be fasting, you should not be fasting. If you're healthy, if you're one of the 3% of our country who's healthy, you might consider fasting. Most people who come to my office don't fit that qualification. So there's too much stress and work in our life that we can't really just not eat because it's even worse for us. But you release chemicals that shut off the production of stomach acid when you're fasting. So if you eat breakfast, let's say you skip breakfast, okay? Sorry, you blew it, didn't have time, got to get out the door. It's 11 o'clock in the morning and you just are bonking, you can't focus, can't get any work done. So you're gonna bow out, take an early lunch. But there's a lot of traffic. It takes you like 25 minutes to get there. It's usually a 10-minute drive. And then there's a line. So now it's like, shoot, it's, you know, 5 after noon. And you're just like, smoke's coming out of your ears, right? You get your food and you sit down. You forgot that you forgot the drink you ordered. So you go back up, wait in line, get your drink, come back. Okay, now it's 12:15. Well, your appetite is hosed, all right, first of all. So now you're living on adrenaline and you're living on cortisol. So now your blood sugar's raised without even eating because you're using chemicals for stress, and the side effect of that is that it's going to shut your gut off. Just long story short, and I've got a lot of articles on that. You can read about that more. But glucagon goes up when our blood sugar goes down. So glucagon goes up when blood sugar goes down, and that shuts off stomach, and then pancreas and gallbladder function. And so that's the first 3. 1, 2, 3. Antibiotic exposure, poor stomach function, and then pancreatic enzyme. Like you're not releasing pancreatic enzymes when you eat, and then we have gallbladder function. And the gallbladder is probably the most B vitamin sensitive organ in our body. All right? So it's still one of the most common surgeries in the world, especially in our country. Cut it out, you're fine, have a nice life. Well, why was it there in the first place? What do I need to do after that? Is there anything I need to take? Nope, we're not going to talk about that. And that's okay. Maybe in the future they'll just refer to offices like ours and then we can get people set up. That'd be fine. But yes, you have to do something if your gallbladder's been taken out because you're not going to make enough bile when you eat. So you have to eat bile with your food. But this gets into the methylation cycle, estrogen toxicity. Women have more gallbladder stones because estrogen makes your gallbladder dysfunctional. Too much estrogen and not enough B vitamins. And then we get into the ileocecal valve, which is just another fantastic part of our body that it doesn't get enough love and respect, and it has a huge impact on motility. So you end up with, you know, you kill the good bugs and make the bad bugs grow, your stomach doesn't get acidic, you don't release pancreatic enzymes, your gallbladder doesn't release bile, and then you're left with a swollen and spasm in your ileocecal valve, and then the motility shuts down. And that is where too many people are living every day. Antibiotics might cause SIBO. It's a true story. There's competition in your gut for nutrition. So if you go and kill all the non-antibiotic resistant bacteria, they get wiped out. The ones that are left have, it's like free reign. They go into there's no competition, so they're going to bloom and blossom and grow. And that helps to establish, the C. diff infection. This study is all about salmonella. Basically saying when you give antibiotics, you increase salmonella. Rapid growth. When you give antibiotics, you increase E. coli rapid growth. And in this study, it actually killed the mice. So E. coli grew so fast that it got into the bloodstream, boom, sepsis, the mouse is dead. But in our bodies, the same thing goes on. A lot of people, and then they'll go back and give you a different antibiotic to kill that one, and it's playing that game at the arcade where you whack them all. Comes up over here, you smash it down. And in life-saving situations, thank goodness we have them. Okay, but that's to keep you from falling into the grave. Once you're on your feet, you got to do some work to get the problem solved. And then finally, we have C. diff, as I mentioned. So these are just 3 studies pulled out of PubMed that just show, hey, here we go. This is Salmonella, C. diff, and the last one was E. coli. So those are common problems. And here's the mechanism of how it works. I like pictures. So you have a happy ecosystem. You've got a mucus layer, and the mucus layer is where the bacteria live. You think about your gut. It's a tube, and there's literally space, a hole. There's a void. It's not part of you. It just runs through you. That's not where the bugs live. They live in the mucus along the surface, right? So there's nutrition produced by your body. You kind of make your own prebiotics. And you make your own prebiotics. You keep the bugs happy, and they convert your prebiotics into like butyric acid and other things that just help your liver work better and help your brain grow, as we talked about. But when you axe them, pre-antibiotic treatment, diversity, right? There's nothing left. There's one little bad guy here, and then there's, one of your good guys. So what did the bad guys do? They just, grow like crazy and start activating genes that are inflammatory, and the whole process starts to get more aggressive. And this is what's happening every time when we're taking antibiotics, and it's also happening in low doses when we eat genetically modified food grown with Roundup. So that's just another reason that we have to either grow our food, eat conventional. Even if you're going to eat conventional food, there's the Clean 15 and the Dirty Dozen. You don't have to take out a loan to eat organic. You just have to think about it. Have a strategy before you get hungry and go into Carl's Jr. because you forgot to eat. Shame on you, right? So I'm like, well, that's the standard of care, guys. You go into the doctor and they find that you have SIBO, they're going to give you antibiotics. It's the standard of care. Oh, there's too much bacteria. Let's kill the bacteria. Next patient. Well, there's more to the story, right? Because we saw there's 5 factors that cause SIBO, and the antibiotics is just the first one. So I picked the revolving door picture because that's what's going to happen to a lot of patients. They keep going back to get more antibiotics. But this study was published in 2008, and basically at 9 months, by 9 months, 50% of the patients, 43.7, 44%, had SIBO again after taking antibiotics. So the moral of the story is, right, you have to change the environment in your gut. Because bugs respond to the environment. Just like you have a beautiful 300-year-old old growth redwood, there's no mushrooms growing on it, there's no bugs chewing into its, breaking down its living tissue. It's strong and healthy for 1,000 years. It falls over. Its life is over. It's going to get turned back into dirt. The second it hits the ground, stuff starts growing on it like crazy because the environment changed. It's still the same tree, but now it's no longer vital. And then you see the other organisms attack it. So we're the same way. If we create an environment that's clean and antagonizes the growth of excess bacteria, there's no way that excess bacteria can live in there. It won't happen. Roundup. Here's your antibiotic reference. That's the patent number. So there you go. That's like its 3rd patent. The first one was a mineral chelator. So one way that it kills weeds is it binds manganese and other minerals so tightly that the plant can't grow. Now you ingest that in your body, what's it going to do to the bacteria in your gut? So the claim is that genetically modified toxins, pesticides, are safe because we don't have the same pathway in our chemistry. Well, technically, yes, that's true. But our bacteria have the exact same pathway because they're just little plants, little one-cellular plants. The same pathway. So, we're just... It's like your ancestor. The thing you give your children is like a healthy gut. If you give your kids a healthy digestive system, they can trust their gut, they can make good decisions, they get a good brain function, they can focus, they can learn, they can be who they're supposed to be. If our gut is always, any parent who's had a kid who's had, the tummy troubles for a while knows that, when your gut's not working, the whole family's stressing out. So, antibiotics, in addition to glyphosate, are coming in the form of food. So, we're pumping our animals full of antibiotics because they're sick too. They're eating GMO food in unsanitary, factory conditions, and this is the result. So, again, learn to hunt, learn to fish, buy local, be a good steward of healthy animals. That's the way to fight this, is, to support those who respect animals and are doing the right thing, and then that'll grow. And organic food is growing much faster as a market than conventional food, no question. And Costco is going around to its suppliers asking them, discussing with them about paying the farmer to switch to organic because the profit margins are better, the demand is through the roof. So, we vote with our choices. The free market does work, but keep buying organic, it's working. So, this is recent data too. Looking at gut, going back to the topic about, the frontal lobe and how it affects our brain. So it's not just, okay, I've killed the good bacteria and I have gas or diarrhea or constipation. It's that 5 courses of antibiotics in your lifetime. Who hasn't had 5 courses of antibiotics in this room? I've maybe had 4 or 5. I'm probably right on the brink, right? You have a 50% increased risk of anxiety and depression with just 5 rounds. We don't know what happens to the patients who come to see us who've had 30, 50, or 80 rounds of antibiotics, right? I'm really glad these PhDs are figuring this out. I'm thankful of that. And more studies will come. It's really needed. You give 1 dose of antibiotics. How long do they last? How long does the effect last? Right?
3 years.
3 years? I love that. I would agree. Probably
Saw some data on that.
3 years. Great. Yeah, this study says as much. It says a single antibiotic treatment in healthy individuals contributes to the risk of resistance and leads to long-lasting detrimental shifts. So it could be 3 years, maybe a lifetime, right? 3 years is a long time for 1 round of antibiotics. So, the lowest dose is 0 and the shortest duration is never, although it's sometimes unavoidable. But, finding someone in your circle who knows how to use herbs and natural things, natural compounds that act like antibiotics, which we'll talk about at the end, are not a replacement for life-saving antibiotics in a hospital setting, but they can absolutely be a replacement for primary care. They work very well. Kids, it's a little harder because they're picky, but with adults, I've seen nasty sinus infections clear in hours once they start taking the right dose of, echinacea and berberine and chaparral and natural antibiotics. So the stomach, I love the stomach. It's just this organ that just gets so beat up, and so much of our happiness depends on this organ. All right? They think of the heart as the organ of happiness, but I don't know how you can feel happy if your stomach's upset all the time. Right? I think there's more to it. I think the stomach has something to do with this. Proton pump inhibitors, yeah, those are medications I really don't like. Again, some extreme, severe cancer, if you have a hole in your esophagus, I get it. There's no other choice. It's drastic. But we should understand that this medication is a drastic measure, because it's usually not used short term. It's supposed to be used for short term. That's what the FDA will tell you.
That's what the literature says.
That's what the literature says. However, I meet people who've been on it for 10 or even 20 years. I know. It's really unacceptable. But what we know is, again, now we're going from that first topic of, antibiotics, food, and medicine, now we're going down into poor stomach function. So the main cause for a lot of people of poor stomach function is what's called iatrogenic, or medicine-induced stomach problems. The side effect of a medication, some kind of procedure that didn't work. But this is hugely common medication, and again, it alters the GI bacteria population by suppressing gastric acid barrier. So think about the word, barrier, okay? A frontier, a wall, a border. It keeps things in the place where they are supposed to stay. So this stomach acid is, if I was stuck on a desert island and had one supplement to bring, that's what I'm bringing. People ask me, well, why would you bring stomach acid and not these other things? Well, because what's going to really get you into trouble if you're in the wilderness is getting dysentery or having some food poisoning from something spoiled that you ate, and that will be a quick and painful loss of life. But if you take your stomach acid, your odds of getting sick from what you eat are going to be near zero. I mean, it's awesome how much this works. So this is going to help suppress it. Stomach acid is going to change the pH of the upper small intestine, and that begins to be an antibiotic mechanism to keep the SIBO bacteria where it belongs. More studies on this. Again, they basically gave 8 weeks of PPI treatment, and the patients were already complaining of bloating, gas, abdominal pain, and diarrhea. After 6 months, the incidence of bowel symptoms further increased. So they're really worried about long-term PPI treatment. That's what the literature says. And SIBO. So they know that if you shut off the stomach acid, your odds of getting SIBO go through the roof. And now we're going to talk about, go ahead.
What's GHBT?
GHBT, glucose something H breath test. So
it was a test.
that's the breath test. That's like a lactulose breath test. I don't know what the GH stands for, but it's basically the gold standard breath test. They're testing everybody to see if SIBO's there. So
you can tell from a breath test.
So the way it works, they give you a type of fermentable sugar. And you drink this, you take a baseline reading, you breathe into a bag at baseline. You wait a certain amount of time, and you drink this liquid, wait a certain amount of time, and you start taking samples. And what they're measuring is they have a pretty good estimate of how far the sugar is getting into your intestines. And then they will measure the output of gas, either methane or hydrogen or both. And that's what they measure with the breath test. Right, so it'll be expelled through the mouth. It'll be generated in the upper bowel, and as you breathe, the amount in your breath goes up. And so they can reverse engineer that and figure out how much bacteria was acting on that sugar, creating that gas. Some people create hydrogen depending on the species. Some people create methane. That has an influence on whether you have a tendency towards diarrhea or constipation, although it's not like hugely determining it, but there's definitely an influence there. So this next concept, I mean, as a chiropractor, a kinesiologist, I continue to go to seminars and train with the best people that I've ever seen on learning how to work on the body physically. But by far, this problem is unrecognized in the healthcare system. It's only found through if it's really bad. This is one of the problems. They can only find, the tools they have only find it if it's severe. That is a severe hiatal hernia. You can stick a camera down the throat and figure out that something's wrong. Endoscopy will find this. Or even an x-ray, because you have the Magenblas, the stomach gas, is actually above the diaphragm, and that's screwed up anatomy, right? So, unfortunately, it will cause food to sit in your stomach undigested for hours. So again, if you want to shut your stomach off and you're not even taking a proton pump inhibitor drug, or Tums, or Zantac, or the purple pill, all you need to have is this going on. Have a car wreck and the steering wheel hits your stomach, pushes your stomach up. Get pregnant, pushes your stomach up. Get really stressed out for several weeks at a time due to personal issues, and you'll start coughing and notice that maybe you get heartburn and get heart palpitations. Those are all symptoms of this problem. And when you get stressed out, your stomach, first of all, your stomach is not like this flaccid, grocery bag that sits down there and holds your food. It's a muscular oven. So when we're just having an argument or having a stressful moment, you know, the stomach is like jiggling and jerking, and it wiggles up into the diaphragm. It's easy to get stuck up there, but it's not going to self-correct very well. It's kind of like, you know, it's hard to give yourself a good back adjustment. It's hard to give yourself a good neck adjustment. It's kind of hard for your stomach to self-correct a hiatal hernia. But once you know how to do it, I teach patients to do this at home, because coming to see me gets the ball really rolling. But if they know how to do it before and after every meal, they're going to see huge progress between now and the next time they come. So I asked this question a few months ago. I've worked with a lot of patients in a distance fashion over the phone as well as in the office. And so many of my patients have heart palpitations, tachycardia, they've had heavy breathing, they feel like something's sitting on their chest, and it creates panic attacks. I mean, how frustrating is that to have a freaking panic attack? So we started to put the pieces together, and I went into Google Scholar and I looked, and lo and behold, there's a phenomenal amount of evidence with hiatal hernias and arrhythmias. So it's a real thing. And there are people in this country, in the emergency room tonight, all across the country, thinking they're having a panic attack. Well, if they're thinking they're having a heart attack, let me back up. They think they're having a heart attack. Heavy chest, pain in the chest, difficulty breathing, pain between the shoulder blades, pain maybe up into the neck. And then what they end up doing is realizing in the ER that no, your heart's fine, but you're having an anxiety attack. Here, go take some psychiatric medications and go meet with your psychologist. Well, the problem is they have a hiatal hernia that's mimicking this problem. And so what ends up happening is, and I'll show you a couple pictures here, but basically, so having acid reflux is a significant finding with anybody with a hiatal hernia. So most people who have acid reflux have a hiatal hernia until proven otherwise. This study just simply said, look, if you have acid reflux, GERD, you have an increased risk of A-Fib. And now we're going to give you an ablation because our medicine didn't work. We tried it 3 times. Now we're going to ablate it 2 or 3 or 4 times, and that didn't work either. Well, nobody's looking at the stomach. Simple thing. Because if the stomach and the heart touch, the heart gets really irritated. It's not supposed to happen. So, this is from 2010, a great study. This was a real aha for me. Hiatal hernia, in the research, 21 times more common to have A-Fib if you have hiatal hernia. So we work backwards and we say anybody with A-Fib, anybody with heart palpitations, tachycardia, goes to the hospital thinking they're having a heart attack, but they just tell you you're having an anxiety attack. They have a hiatal hernia until proven otherwise. So I had a patient tell me that 21x, that's huge, massive odds, right? I'm not a betting man, but you know, if I was, I'd say that's pretty good. She realized that once her stomach, this is a woman who used to run marathons, and she just, you know, hard charger, real successful with her like PhD research and everything, and just real athletic. And her health crashed for no apparent reason. She ran a big marathon, got really sick afterwards, and didn't really recover. But she was having anxiety, okay? And we determined through working together that it's actually, and she had a lot of stomach dysfunction, and so we determined, okay, so we're going to start with your stomach, because that's where you always have to start in treating someone, right? Every time you work with a patient, or you approach, let's say this, anytime you approach a problem, you need to like create a metaphor to understand what you're dealing with. So a person, we're going to use a bucket, all right? So just like this cup with my green tea, you can have holes and you can have cracks and holes at different levels. And different people are really good at different cracks. Oh, I'm an expert at this shaped crack right here, and I'm really good at the cracks at the top. I can help you. That's great. Fix those cracks. But if it's not the bottom crack if you don't fix the hole in the bottom first, nothing's going to happen. You won't see any results, and you'll wonder, well, that was a waste of money and time. Well, it just fixed something up here that had nothing. That's the fourth thing you should do. So it's how you sequence it that makes a difference. But this patient, you know, she basically said, look, once we fixed my stomach, I realized that my stomach was causing my chest pain, and my chest pain was making me worry about my heart, and worrying about my heart was giving me anxiety, and that was screwing up the rest of my life. And thank you so much now that, you know, the stomach pain went away, I see everything connected. And now she's doing great. It's just like you change your paradigm. You know, once you, oh yeah, geez, okay, this caused this. A caused B, B caused C, C caused a D that I really didn't like, and I was freaking out about D, and then it gave me E. And I go and get treated for E all the time, but go back and fix the root. So stomach is huge, guys, massively important problem. And SIBO and everybody else. All health conditions, you got to look at the hiatal hernia. It literally squeezes the heart. This is from 2014. This was a patient, just like a case study. Her fluttering was caused directly by the mechanical effect of the large hiatal hernia pressing against her heart. The heart does not want to smash and get rubbed and pushed against the stomach. Sometimes when people will get worse symptoms at night when they lay on their left side versus their right side. There's something mechanical going on in a lot of these cases, and this is the main thing. And again, this is kind of harder to read, but this LA is the left atrium of the heart, and then the hiatal hernia is they're just touching. All right. So the presence of hiatal hernia may trigger development of A-Fib especially in younger patients. So here it is, guys. Anybody in your life, A-Fib, tachycardia, palpitations. This is what's happening till proven otherwise. 21X. And then there's also this thing called aerophagia, where you swallow air. That's a mess too. People get stressed out. We worry, and then we go eat, and we do it over and over again, and it's a world we live in. And what ends up happening is our brain doesn't relax, and so the blood flow stops going into the top part of our brain. It kind of goes into the lizard brain and the mammalian brain. We get real emotional, and we don't digest well from all these reflexes happening through our nervous system. And then your vagus nerve kind of screws up. I mean, who here's ever experienced or knows someone who's had a vagal experience? Vasovagal experience? You know what that is? Sometimes people drink cold water and they pass out immediately because of the shock of the water fires back up into the brain through the vagus nerve, and the brain goes, whoa, and kind of freaks out. But swallowing air is another dysfunction that's a mechanical thing with the TMJ and the tongue and the muscles in the front of your throat. And as a physical medicine doctor, kinesiologist, there's a lot you can do to fix these dysfunctions in people. And a lot of us are walking around with a tongue that doesn't push the right way and doesn't swallow correctly. Think of everybody who snores and has sleep apnea. It's a muscle nerve problem in the back of the throat. So a lot of patients who have gut problems also are swallowing air. It makes you bloated, and it causes you to dysfunction. Okay, so we've talked about antibiotics, we've talked about stomach dysfunction, and now you have learned more about the hiatal hernia than most people ever will, but it's really important.
So how do you help a hiatal hernia issue?
Thank you for asking that question. So I'll do a quick verbal demonstration. Basically what we do is we take the stomach and we trap it with our fingers, and we pull down so that the skin is tight, and we work with breathing. So in this picture you can see that the diaphragm is a real amazing muscle, and it's just big dome. When we breathe in, it flattens and goes down, so it's pushing the stomach and all the abdominal contents towards the floor. So we have someone breathe in, and we trap the stomach in its furthest inferior position, and we hold the soft tissue. And then we instruct them to cough, and as he coughs, his diaphragm moves towards his head really quickly, and we pull. We don't hurt the patient, but we pull with enough force to start to tug the stomach in the opposite direction. That's basically what I teach my patients to do at home before and after meals. I'm going to make a YouTube video just on doing that and put that out there so that everybody can play around with it at home. And if you need more help, you come and see someone like me. We'll help you out. But that's how we do it. It's literally a mechanical thing. Oftentimes there's some diaphragm rehab we have to do. Like if the diaphragm is really weak, it won't hold that crust or the opening of the diaphragm tight enough, so the stomach has a tendency to go back up. But over time, I've seen horrible hiatal hernias go away completely.
So symptoms of someone who eats or drinks something and they just immediately have to discharge?
That would be a first line thing to look at. Absolutely. Someone who's vomiting after they're eating, nervous stomach. But again, if that's happening, hiatal hernia until proven otherwise. I had a patient today who actually said that, big, strong service member of the armed forces, Army guy, wouldn't think he's the kind of guy who's going to vomit when he eats, but yeah, man, I'm so stressed out that you know, I can't eat, I'll eat, and I'll just vomit a few minutes later, and we had to pull his stomach down. So and we worked on his ileocecal valve, so that can help too. But it's all one muscle, okay? It's 26 feet long, but it's all wired together in its own system. So if something's irritating the colon, you can vomit out the top. And if something's not working at the top, how can you eat something and 10 minutes later have diarrhea? It hasn't gone 26 feet through the tube. It's a wave that goes, whoa, freak out, and then boom, something happens. So, any other questions on that? We're going to go to gallbladder now. And again, I love the gallbladder because it just doesn't seem to get any love, and it's so important.
It's $26,000 to have it taken out. There's a lot of love there someplace.
That's true. For someone, there's a lot of love for some people there, yeah. Yeah, I'd love to see a report of the top 10 surgeries and how much they make the hospital. If anybody can get their hands on that, send that to me. Please do. If they know like a hospital administrator, I'd love to see that. Promise I won't name names, but I'll probably share that with people. So, it's soap. That's what bile is. Can you imagine living in your house without it? What would happen to civilization without soap? We'd be in deep trouble, okay? It allows us to do many things. It emulsifies fats, all right? So fats are hard to break down. Fats and water don't mix. Bile is soap, and it allows the myelination, it allows you to chop the fats into small, teeny little, they sell supplements now, the nanolipid supplements, it's, liposomal supplements. Well, all that is like what bile does for your body every day. It makes a lysosome with bile so you can absorb what's in your diet. But again, if this doesn't come out of our gut, you're not going to have dish soap in the sink to get the dishes clean between meals, all right? Your hands are not going to get washed after taking your dog for a walk, okay? Going to the bathroom. This is not good in our personal life, and it's not good for our gut life. So bile does many things. It's also the main, we'll talk about this in a minute, but it's a huge detoxification factor. So people ask me, Doc, I want to make sure I'm detoxing. Don't we need to work on detox? I'm like, well, yeah, you do need to work on detox, but you need to get your gut working first, because this bile that comes out of you when you eat is the main mover of all your heavy metals, toxins, hormones. It's incredible what comes out of here. The urine pales in comparison to what comes out in the bile. Prevents bacterial overgrowth, because just like the soap that cuts the bacteria off your hands and rinses it down into the sink and down the pipes, bile rinses the bacteria off the lining of your gut. So if there's no bile coming, that stuff is going to stick into the small intestine and get stuck in the villi and stay there a lot longer. So bile is huge. We use a lot of nutrients for that. We'll talk about that at the end. There's some pretty basic stuff you can do. So another thing that's going to happen when your bile's not coming out, you're going to have more of a leaky gut. And that's a buzzword that's real common these days. I mean, this half a tennis court sized surface area is not 2 inches thick. It's like cellophane, right? It's just really spread thin, so it's super thin. So it's easy for that to leak. But the gut is always growing and repairing. When we have a bowel movement, the vast majority of what's in the toilet are our own dead cells. And so those cells are turning over quickly. They're growing, the fastest growing tissue in our body. But again, without bile, you tend to get these dead bodies of the bacteria leaking into the bloodstream, because this is all tons of blood vessels here nourishing this tissue, and it all leaks back into our bloodstream, and that's more of a burden for the liver to have to deal with, raises our inflammation, risk of infection. And then now we're looking at gallbladder again. This is kind of how we make bile. So we're zoomed way down into the liver. This is actually a liver cell, and this is a little tiny green stream where bile will be made that'll flow down, and eventually collect in the gallbladder. That's where we're at. And you can see these enzymes, if you get into researching methylation, this is like how your B vitamins actually make the process happen. But these are lipids, these are phospholipids that have to get made and to make the bile run. So if you run out of these B vitamins, the bile gets thick. It gets like, it won't be able to be squeezed out when you eat. So you want to think about your dish soap, just to use this example, okay? You take a bottle of Dawn dish soap, and you hold it like this, and you smash it with the lid open, it's going to squirt halfway across your room, right? And you could squirt it pretty far. It's runny, all right? But you couldn't do the same thing with honey or molasses. Could you, right? So this is just why the B vitamins and those gene pathways have a huge influence on the gallbladder, because without the right B vitamins, you're going to change the nature of your bile, and all of a sudden it stops coming out. And that happens years before stones show up, by the way.
Before what shows up?
Stones. See, by the time you have a stone, you're looking at a process that's been going on a long time. I mentioned this just a minute ago. I mean, here's what comes out in the bile. Xenobiotics, Roundup, glyphosate, flame retardant, paint, VOCs, whatever, phthalates. It's all that stuff's getting pushed out of the liver into the gallbladder. So the gallbladder is this incredible trash can. It has a heavy load to carry. And if you don't empty that trash can, imagine working in a restaurant, which I have, and not necessarily a clean one, kind of a greasy one, right, back in the day. You don't take the trash out for a couple of days, I can't imagine what that place would be like. That's what your gallbladder does. It holds the grossest stuff your body's trying to get rid of. And if it doesn't dump, it's going to get inflamed. So you have, heavy metals, drugs, your thyroid hormone, all this stuff has to get out of there in order to be healthy. And one more thing on the gallbladder. This is just showing you that basically you gave mice a lot of estrogen, and the estrogen turned into sludge. It basically creates gallbladder sludge. Because the more estrogen that's poured into the body, the more estrogen the body has to work through, the more B vitamins get drawn down. So let's say here's your pile of B vitamins and here's your estrogens. You're good, okay? But now you start to eat a lot of milk and eat a lot of cheap food, and you start taking birth control pills, and maybe you live out in farm country where they're spraying xenoestrogens all over the place, and now here's your estrogen load and here's your B vitamin supply. And you got to detox the estrogens. Well, now you've just depleted all your B vitamins and you're left with estrogen. And so then that's the equation, right? You have to use these B vitamins in order to detoxify this stuff. And if you run out of B vitamins, then you're going to start gluing estrogen to sugar, and that's what creates molasses in your gallbladder. Molasses will not squirt out. You tip the jar over and you can wait a couple minutes and you might see a drop on the floor. So when you eat, it's not going to get down into the gut. And then one more thing, just on the topic of the liver gallbladder, what you end up running out of is choline. That's one of the things that depletes when you've got a lot of gallbladder issues and estrogen problems, and that's fatty liver. And there's studies I have that show that 30% of the population has diagnosable fatty liver. Pretty important organ. We don't want anybody's liver to be fatty. They used to think it was just alcoholics, and then they had to come up with a new term called non-alcoholic fatty liver because of all the sugar. And there is an argument that sugar is alcohol. Every sugar isn't alcohol. I've seen that. So I think there's some kind of make that case, whether it's glucose, fructose, too much of, the refined carbohydrate diet is just poisoning people. All right, that's a lot of information. We're going to take a deep breath.
It's a good idea.
Any questions on that so far?
On the choline, are they still requiring how much a day, like 1.8 grams to reverse fatty liver?
That's a great question. It depends. So the daily intake of choline I don't have on the top of my head. I know it's at least 500 milligrams. And I saw studies, what they did was they put people on a choline deficient diet. And then they checked their genes. They compared certain genes in this group of people, and people with methylation related genes got fatty liver like extremely fast. Whereas people with normal methylation pathways were able to avoid fatty liver. So every gene that screws you up kind of gives you an advantage, so it's not always just a negative thing. But yes, choline is real important. Estrogen, here's one aside. Estrogen makes your body make more choline. So when you're growing a baby, when a woman is pregnant, her estrogen is 30x over baseline. And so that estrogen upregulates her body making choline, and when they give choline to pregnant moms, the babies are born with bigger brains. So Mother Nature has a really elegant solution. The hormone that's really high in pregnancy helps her make more choline, which helps her prevent having the deficiency, but also feeds the baby's brain. But yeah, I mean, you can reverse fatty liver. See, you can't reverse cirrhosis. you've gone, that's the line you can't cross. But this is where methylation support, choline, B vitamins, bile support really will help. And lifestyle changes have to go along with that and everything, but you can reverse it.
But if a patient is allergic to eggs, which is the hardest source, then you would give them a supplement?
I would. I consider supplements just concentrated food. So I say, okay, here's food, it's your base, you can't live on supplements, you eat food. But a lot of people, as we've already shown, are eating food and they're not absorbing any of it. So then you got to use supplements to get them back up to where they're feeling good, and then you can back away. Most people have an egg allergy, however, are not allergic to egg yolks. So if they try to just eat egg yolks, that's another option. It's the albumin and the protein in egg that's the allergen. So it's interesting. Yeah.
Sorry. What's the test and how close to 10 to 20% when they say you've got either fatty liver or cirrhosis of the liver? Is there some degree of not a 100% reading? I mean, yes, for sure it's 100% your cirrhosis, or do you know?
Well, I think they actually have to do a biopsy for cirrhosis.
Okay.
But in ultrasound and other imaging studies like MRIs, CTs, which you never want to do a CT because you think it might give you more information. You only do a CT if your life depends on it, right? CTs have like 10,000 times the radiation of a normal X-ray.
10,000 times?
Okay, maybe it's not 10,000. It's at least 1,000. It's either 2 or 3 orders of magnitude.
Wow.
So there's a whole study on CT scans, and there's 10,000 people who die every year from cancer they got from a CT scan.
Wow.
So MRIs are so much better. So much better. So yeah. So all right. Yeah, you just take some melatonin and go on in the MRI. All right. So we've covered some things so far. Antibiotics, stomach function, hiatal hernias, and bile. Now we're going to look at pancreatic enzymes. We don't have a lot to talk about it. There's not a lot of data on it. But basically, again, you look at your body's normal GI function. You have stomach acid, you have bile. The acid changes the pH and provides a barrier to keep bacteria down where it belongs. And the bile obviously does the same thing. And now you have pancreatic enzymes. And pancreatic enzymes are fantastic for fighting cancer, preventing cancer, for helping with inflammation from injuries, but they also are going to digest the outside wall of bacteria. So what these enzymes they don't care if it's part of you or your food or the bacteria. If they can get to the active side of the enzyme, they're chopping it up. So they're going to chew up bacteria as another method to protect you from SIBO. So those are now we've gone through some, so that's pancreatic enzymes. So we're four points through. We have one more point to talk about, and then we'll get into the solution. Do you have a comment?
Well, I didn't want to be rude. I just need to use the...
Oh, please help yourself. No.
I'll be back.
All right. Well, so, and again, let me back up and say one thing about this and the gallbladder. It's like an elegant orchestra, right? The way our body works. When you see food, you start the digestive process, right? If you're a Pavlovian dog, they ring the bell and you start the digestive process. But just looking at food starts the process of salivation. You chew food, and as anyone has ever paid attention to this, the only thing that you cannot break down fats or protein in your mouth. But you could put a gluten-free cracker in your mouth, and in 5 minutes the cracker's gone. Because you have amylase and the enzymes in your mouth to break down carbohydrates. So of all the foods, the ones that are the easiest to break down are carbs. The easiest to break down, the easiest to absorb are carbohydrates, okay? Fats and proteins are much more complicated, much harder.
What and proteins?
Fats and lipids and fats and proteins. So when the stomach is acidic, that's step one. And then the stuff leaving the stomach, right, is acidic. So if the stomach is making stomach acid, it's all mixed into what we call the chyme. And then the chyme leaves the stomach and it hits the small intestine. And on the walls of the small intestine, there's little sensors that say, okay, the pH is low, okay, pancreas release, and gallbladder squeeze. There's signals that tell that to happen. So if you have your food coming into the small intestine and it's not acidic, the signal isn't sent, right? So everyone on PPI drugs, Tums and Zantac, who chews food, swallows, and lets it get out, and it leaves the stomach, there's not a good strong release of pancreatic enzymes because the chemistry isn't correct. So I just want to point that out. It's stomach first, sets the tone, and then the gallbladder and the pancreas all get their signal to release based on the pH of what's coming out of the stomach. So not enough stomach acid equals these won't be working. And now we're going to talk about the ileocecal valve. Man, here's another one. This one's even maybe less appreciated than the hiatal hernia. Has anybody here in this room had this treated on them yet? 1, 2, 3, few people. So it's a muscle.
Well, when you say treated, what do you mean?
I mean, you've gone into a doctor of any kind who said, "Sir, son, you have a problem with your ileocecal valve and we're going to treat that for the next 30 seconds." I think we do it in my office. It's part of my routine assessment. But basically, the ileocecal valve is a check valve. It's a backflow prevention device. All right? And as one of my mentors told me long ago, he said, God put the bathroom over the kitchen and the bathroom leaks. Okay? If you're not careful, that's what's going to happen. So the ileocecal valve is ileum-cecum connection, which cecum is just like the very beginning of the colon. And so it's a valve that's a circular muscle and it opens and closes. It controls, it's kind of the pace setter and the gatekeeper to peristalsis.
What's cecum?
The ileocecal valve is.
Okay.
The cecum is so the ileocecal valve is what joins the small and large intestines. It's opening and closing throughout the day, controlling the flow of food, right? So in the small intestine, that's where we absorb most of our vitamins, proteins, fats, and carbohydrates. What is absorbed in the colon is most of our electrolytes and some water, right? So this valve controls peristalsis. What do people with small intestinal bacterial overgrowth complain about? I hear a lot of complaints about just terrible constipation. People they didn't know this was abnormal to poop once a week for 30 years. Okay, all right, I'll give you that. You were young, you were a kid, okay. But now they're using water enemas to do it every day, and no one's ever helped them or taken a look at their ileocecal valve, right? So this is huge, and the two processes that most commonly predispose to SIBO are diminished gastric acid, which we've talked about, and intestinal motility shuts off. Because normally with the motility of your gut kind of squeezes and pushes the bacteria down too. You know, like a kid trying to get a yogurt out of a little squeezy tube, you know. I use a lot of kid metaphors, fresh on my mind. Another study, this was a great one. Again, from the type of work that I do, I was happy to find this. Basically, it said that SIBO is a significant and it's an increasing problem, that's for sure, but impairment of the ileocecal valve is hypothesized to be a risk factor. Low ileojejunal pressure, so they're using, scientific language, but a weak ICV is significantly associated with SIBO, and that was 2014. So if your ileocecal valve is stuck open, as it is in the vast majority of people that I see, 90%, maybe 95%, have an open ileocecal valve. So again, it's a circular muscle. Some of the fibers, when they contract, close the muscle. Other fibers, when they contract, open the muscle. If it's stuck open, what will happen to bacteria in the colon if that is left open?
Takes a little walkabout.
They're gonna go get into that happy middle class up in the small intestine and grow their family, right? That is just nature.
Build a wall.
No comment on that tonight. But yeah, we're gonna fix that Mother Nature's design to get it working better, get it working the way it's supposed to be. So this one's kind of wordy, but this is 2012. Subjects with a positive breath test have a defective ICV. You have SIBO, your ICV doesn't work. That's what they're telling you. That's the 5th factor that we've looked at so far. So defective ileocecal valve, if this valve is weak and open and flaccid, basically you're going to get SIBO and IBS-like symptoms. Because they call this, I love the language, the reflux of fecal flora. Oh man, that does not sound fun. Doc, I'm refluxing fecal flora. Can you help me?
Sounds so much prettier.
It's more, yeah, it carries more oomph with it, sure. And then gas and all these other symptoms. So yeah, refluxing fecal flora. I might have to add that. It's kind of a little bit of a...
An essential oil?
Yeah, maybe we can work. We'll put something together. Here's another picture that just, I mean, graphically, again, if you're a visual person, this is what they're measuring with the device, the pressure that this squeezes, okay? Normal, high pressure, SIBO. It's flaccid, it's not working. There's no way that check valve is doing its job. So you eat food, you're eating fertilizer. Food, what do you get when you eat? I get dopamine, I get happy, I get energy. I feel like I can go outside, go take on the world. That's what, food gives us our life. Well, food also feeds bacteria. So when these guys are running out of the colon up into the small intestine, they're just eating your food first. And Lord knows what happens when they eat your food. They're going to poop out all kinds of organic acid toxins that create a whole other host of problems. It's the ICV. And if you don't have a chiropractor, kinesiologist, or someone who knows how to assess and treat this, and you don't have to have a $10 million MRI machine to figure this out. It takes literally a minute of time. And then you can teach the patient how to do it at home. It's just a simple yet incredibly powerful thing that's low cost, zero risk, and fixes one of the main factors of SIBO. It's just a massage. So I'll just kind of demonstrate basically. I don't think I have a picture of the abdomen. I maybe do here. So basically what you do is you essentially use manual pressure over the ileocecal valve, just like you would massage a calf, a gastroc cramp, or a hamstring cramp, or a muscle in your neck that got irritated because you were shoveling too much heavy wet snow. But that is literally, in the big picture, all you have to do. Now, as a doctor and what we test for, there's certain directions that massaging makes a better improvement. I mean, there's just massaging like a shotgun approach, and then there's like a sniper-specific way to do it. Even if you just start shotgunning this, you take your hip bone and your belly button, and you basically draw a line from your belly button to your hip bone. And what you're looking for when you look this up online is the McBurney's point. McBurney's point.
So far apart, mine are almost in a straight line.
Everybody's got different shapes. And, this is what doctors are trained to look for like rebound pain for appendicitis. It's the same area, but that's where you're going to access this and do your massage. And this is just another study that I jumped over. Same thing. People with normal subjects, it gets really hard. The SIBO squeezes, or the ileocecal valve squeezes as a normal part of peristalsis, moving your stool and your food through your intestine. People with SIBO, it just doesn't work, but it can get fixed. It's not like it's defective and you were born with one that didn't work, unless maybe you have Hirschsprung's disorder or some. Most people with SIBO, 99.8% of them, had this working at one time. Something happened and it shut off.
And do you think that if you normalize the beneficial bacteria in the colon, that has an influence on the ileocecal valve?
I would, yeah.
I'm just guessing, but because I did read a study about the SIBO, when they could test it in different areas, it was closer to the ileocecal valve.
Was where the most of the overgrowth was?
Yeah, so I was thinking if you normalized, the colon, then maybe that's what they do with fecal transplants and the SIBO gets better. What do you think?
I think so the question was, if you were to normalize the intestinal flora in the colon, how would that have a beneficial effect on the ileocecal valve? I would say my answer would be absolutely it would. Because the reason you're getting the ileocecal valve to malfunction is the environment. Again, we're going to go back to the idea of the environment is what rules the roost. It's true when you look at genes and everything. If you have a lot of inflammation in the colon and ileum, then that inflammation makes muscles sore and weak. So just like if you have, so in other words, our muscle tissue is going to be sensitive to inflammation, and when you get the bacteria improved, that kind of balanced approach in the colon does have an anti-inflammatory effect. So in other words, the right bacteria would lower inflammation, which will probably greatly help that. But I still think that you need to do at least a couple courses of manual therapy to get it back in place. And then I would say, okay, if you get that back in place with manual therapy and you get the colonic flora correct, it'll stick. But if you just do the rubbing but don't change the diet and fix the environment, it'll go back out again. And so I think that was a good point. I mean, anything you do to lower inflammation is going to make a difference. Again, this is just saying, this slide basically says, okay, surgery in your colon will give you SIBO because it screws up your ileocecal valve. So all surgeries, some are necessary, but we want to have the fewest possible. And then, just an overview of peristalsis. I mean, your gut is squeezing things, and that's how it propels them down the tube. And what I found interesting about this is from 2001, is that certain bacteria slow down peristalsis. They did this study. There's a lot more text on this study that I chopped out because we didn't have room for it. But they did like E. coli, and E. coli, slowed down the gut, and another species sped it up. So people say, well, what came first, the chicken or the egg? Well, let's say you get an overgrowth of E. coli. It's going to have a negative effect on peristalsis, which promotes the growth of more E. coli. It's almost like the bacteria are trying to create an environment to their own advantage. They're just trying to survive, trying to hack it in the gut environment. So we are making some progress here. We've covered 5 things that cause SIBO: antibiotic treatment in the food and then in your medicine, stomach function that doesn't work, poor pancreatic enzyme function, poor gallbladder function, and the ileocecal valve. Now we get to talk about how we fix it. Protocols, it would be great if you could come up with this SIBO magic and write a book and say, everybody who has SIBO, do this and you'll all get better. But that's not the way the world works. We're as different on the inside as we are on the outside. But there are certain truths and points, things that matter and make a difference for everybody that I want to communicate tonight that I think can be of value. And this is what we do with our patients. So this is a picture of Dr. Seebecker. She practices in Portland. I haven't met her personally, but she's been doing a good job educating about SIBO online and raising awareness of it. And she built this diet that we have used, shared it with our patients, that's color-coded. It's just a really sort of easy to see, easy to read PDF. You can download that on our website, beyondmthfr.com, and you can see the other information in the protocols section under SIBO. But this is, just gives patients a roadmap. Okay, so green you eat is, you can pretty much eat without worrying.
What's SCD?
Specific carbohydrate.
Specific carbohydrate.
So it's kind of a blend, right? Specific carbohydrate is used to treat IBS, but IBS, what does IBS mean? It doesn't mean anything except a set of symptoms. So who knows, maybe half the people or more with IBS really have small intestinal bacterial overgrowth. So we're getting, they just have different names, but the idea is that you're limiting foods that are bacteria prebiotic suppliers, okay? So why would you want to fertilize a nasty mess of bacteria when your goal is to make the population smaller? Just a question, right? Wouldn't make sense. So this is designed to give patients an overview of which foods, green, yellow, orange, or red, are most effective for not feeding the mess as you're trying to hack down the population. It doesn't work. A lot of patients of mine who eat off this red category, accidentally, they get bloated, they look like, God, Doc, I'm 8 months pregnant. Here's what I ate. Well, okay, And often they'll tell me that on the first visit, and once we talk about the diet, they don't really cheat because they want to get better. But that's it. The low FODMAP diet, specific carbohydrate diet, Dr. Seebecker put this together. This is probably the easiest to read and I think the best reference that I've seen out there. You can find it online on our website. Hiatal hernia repair. This is just the picture of. This is the do-it-yourself version. You can Google this. It'll show right up if you go Google and search images. It'll be right there. You can read about it. Now, I already showed you tonight how we treat it in the office using kinesiology, and then there's no substitute for finding a doctor to help you do this, but if that's not possible, doing some work on your own will make a difference. In this example, you fill your stomach up with water, and you basically are dropping, and you're hoping that the weight of the water in the stomach starts to pull it down towards your feet. You could probably blow out as you hit the ground to move the diaphragm faster. So you can do a few things to make it work better. But one good session with someone who knows what they're doing would get you on the right track too. But that's what you got to do. You got to fix that hiatal hernia to get the stomach working, because that's like the linchpin and the keystone to the rest of the digestive system functioning. Okay. Another part of this kind of manual therapy is the ileocecal valve massage. This is a kinesiologist demonstrating, kind of the contact, and it's a deep massage, but you're not crushing the intestines against the wall of the pelvis and against the spine. You're getting the intestines moving, but you're just trying to massage it, just like you would go up to your partner and massage their neck just to get them to relax. You're just trying to do that to the ileocecal valve. 30-60 seconds, you're good. Stomach acid support. Again, I like to use betaine HCl. I think this is my desert island supplement. That's what I've seen. It's what I've experienced. With the amount of dysfunction in people's stomachs, with all the heart palpitations and hiatal hernias, I think that everybody should do a trial with stomach acid to see how much they actually need. Well, I don't need stomach acid. I don't have any reflux. How do you know? Reflux is one symptom. There's a lot of people with silent GERD. It's a whole medical diagnosis. Coughing, bad breath, raspy throat, heart palpitations, heavy, chest pain, anxiety. And so this is the MetaGest challenge. This is also on our website, and this is just developed to give an individual a way to run an experiment to determine how much stomach acid they actually need, right? So some people need 1 after every meal, and that's the optimum dose, and some people go up to 7, and they're there for a week, and then I talk to them, and 3 weeks later, and they're back down to 2. So they've given their body tons of stomach acid. By the time you get to 7 of these, it's what we call a physiologic dose. It means that your stomach is practically making 0. And no one wants to take 7 of these tablets after every meal for months on end. That's expensive and cumbersome. But it does show you that, okay, once you hit 7 for about a week, we work people back down. But people who hit 7 are not making much stomach acid. I do good at 2 or 3. Bigger meals, you take a little more. Smaller meals, you take less.
How many milligrams are those?
These are 2 tablets is 650.
Wow.
So by the time you're at 7, you're getting close to 2,000, 2,100 milligrams, I think. Again, pretty heavy dose. But surprisingly, people, they do great on it. We see it in our patient population a lot. This is like the one, this is a supplement that helps kids who are addicted to drugs and have anxiety not be on, get that problem under control. We've seen it more than once. I just think there's something about kids growing up, being stressed out, teenagers. They try to self-medicate with, drugs. But in this whole process of being stressed out and going through that whole thing, they develop just a really screwed up stomach. And they want to get better and they want to feel better, but they got to be able to digest food in order to make good neurotransmitters. And so it's like you start fixing the stomach and all these other things just line up. Pancreatic enzyme and bile support. Now, timing of the nutrients are important. Timing is important. Stomach acid is to be taken after the meal. It's the cherry on top of the sundae, the last thing that goes into the whole thing, okay? The reason is that we don't want to interfere with the physiology of your stomach making stomach acid during the time that you're eating. So we don't know how much acid you need until you get to the end of the meal and you've made everything that you're going to make, right? Just logically, that's not my idea, but it makes sense, Now pancreatic enzymes are a different story. So where do the pancreatic enzymes get released? Where, in your mind, in your map of the gut, where are they going to be released?
And duodenum?
Duodenum is the correct answer. Do you want them there before your food arrives or after, if you had to choose?
During? Before.
Before is a good answer. During is a good answer. But we're gonna have patients take the pancreatic.
You got the right one.
No. You got the right answer. Actually, yeah. So pancreatic enzymes go in before you eat, and because it's a supplement, we have to pick when they're going to go in. So I would rather the enzyme be in the duodenum. 5 minutes before you eat, you take this. Basically, right when you sit down, you got your plate of healthy food, you're hungry, licking your chops. Okay, wait, let me take the enzyme, boom, then start eating. And what you're going to end up doing is making sure that when the food leaves the stomach, there's an enzyme hitting it right away, right? So if you took it in the middle of your meal, you might miss part of your meal. That's all. And this is a pork-derived product, and that's not suitable for every patient. So there are vegan options, but certainly, in my opinion, the strongest pancreatic enzymes are those derived from porcine sources. They're chemically identical to what we make, and this is the extra. The Pan9X extra strength from Metagenics it's a big gun. It's a lot of enzymes, but when you want to not mess around, you give them 2 before every meal for a little while, then you go to 1, and then you can go to a less strong product. But I want to make sure everything gets absorbed, because it's like a snowball effect in the right direction. Once you start absorbing your nutrients, then you start to feel better. Then your gut works better. Then you need less. But if you don't go big enough in the beginning, you can't get out of the rut.
Paddling upstream.
So now we have gallbladder support. These are my 2 main products for that. I like Metagenics for lots of reasons. There's other good companies out there. There's, in my opinion, a handful of really top companies. But this lipogen is more like bile salt. It has bitter extracts of artichoke. It has a little bit of methylation support, choline. It's more for helping you absorb fats in your diet and kind of giving you a little bit of that methylation support to make bile from the methylation side of the equation. It also has some taurine. So to me, it's a little more of a purely digestive support for the gallbladder. But some people who have SIBO, not many, but some, are even sensitive to the artichoke. There's people who are just crazy bloated to all kinds of things. So you really got to be flexible in this kind of patient population. But that's excellent gallbladder support. But then the Trancor is also really, really good gallbladder support. And Trancor has N-acetylcysteine, green tea extracts, non-caffeinated, and it's got a lot more taurine, B6, and magnesium. So what it's going to do is be more of a detoxification effect on the gallbladder rather than a pure digestive support, but it also does make the bile run better. It's just not going to help you absorb the fats in your meal. That's all the difference is. You could take them both. But lipogen is more, this type of thing with ox bile salts is more to help you get the fat from what you're eating into your body during the meal. Trancor is more for detoxification through the gallbladder. They both work well. I end up using more Trancor than the other one because my SIBO patients are very sensitive to B vitamins, especially B12 and folate, so I kind of had to dance around that for a while. Trancor works really good. It also increases GABA, so it kind of tranquilizes people and calms them down. A lot of people I work with SIBO are just very anxious people because of all the imbalances that we've talked about. Now, prokinetics, herbs, tea, tinctures. There's lots of different ways to do it. Ginger is a great prokinetic. I like ginger. I prefer to peel it with a vegetable peeler and then squeeze like lime juice into a small dish and just put that over everything I eat. It's kind of spicy and tangy. But there's lots of different ways to get ginger in. Ginger is a good one. 5-HTP. So again, 'tis the season of the gastroenteritis, right? And when they give you Zofran, they're giving you an anti-serotonin medication. There's a phenomenal amount of serotonin in your gut. Okay, it doesn't mean you don't have depression in your brain. You can still have depression in your brain and have a whole lot of serotonin released in your gut and do a neurotransmitter test, and they find high serotonin because we don't know where it's coming from. But if there's a gut allergy and a leaky gut process, serotonin is playing a role. And one of the side effects of serotonin is diarrhea. So someone who has diarrhea, we don't want to give them 5-HTP or recommend it. But someone with constipation, that's a better choice because it does help them synthesize serotonin, and it does become more of a prokinetic in the person who's really sluggish. Too much serotonin equals diarrhea, not enough is constipation, just based on how the gut neurology works. And then huperzine, I didn't put the product up there, but Metagenics makes a product called Sariva, and it has huperzine, and huperzine is an herb that's a natural choline esterase inhibitor. What that means in plain English is it raises acetylcholine levels. And acetylcholine is the neurotransmitter that your parasympathetic uses to run your gut. So like your vagus nerve and all the digestive functions are going to use acetylcholine in order to make that whole thing work. So if we can raise acetylcholine levels and support that, then you tend to see better increased motility, and the studies show that as well.
Now, number 4 here, are you saying one of those 3, ginger, HTP, or?
Either or. It's
Or
kind of an and/or situation. If you're, these are just ideas for individuals with constipation to experiment with which of these 3 gives them the best result.
So all 3 of these are really to treat the constipation portion of SIBO.
That's correct. Huperzine was originally developed and investigated for its effect on Alzheimer's and dementia because acetylcholine levels have a huge impact on memory function. So it's not just a gut neurotransmitter, it's a brain neurotransmitter. So you get a lot of benefit, there's multiple benefits. The studies that I found on huperzine were done in the population of people with dementia. And they're trying to say, well, if we give them an acetylcholine, if we give them this herb, are they going to have the runs because it increases motility? And they found no, it just increases motility in a safe way and doesn't really cause any major side effects. And then I have to say caution, probiotics. Again, this is an individual basis. But if you have a really sluggish gut and a lot of constipation and there's a large bloating pattern, probiotics may not be the best for you in the beginning because you may already have a phenomenal amount of lactobacillus or bifidophilus. Why would we give you more? The patient with diarrhea, I'd be much more inclined to give them probiotics because they're losing the bacteria more quickly. This is just an individual case. It's just, through trial and error, working with, this is the kind of clinical experience part of it, but it's an individual kind of thing. It's unclear. There's no way to really tell who's the best fit for probiotics. I often forego giving probiotics when treating SIBO for the first few weeks. Just get the population down, and then and if we do use probiotics during this time, it's usually low dose in these individuals. Even though probiotics, have been shown to poop out antibiotics to kill the bad bugs, it's just you got to be cautious.
What about just doing suppositories? Since you want them in the colon anyway.
Suppositories are good.
Suppositories of what?
Of probiotics. So we have a couple techniques we use. We'll have patients do like a probiotic enema. We do that, have them do that. So, the fecal transplant that was brought up earlier, that is a kind of aggressive gut protocol. You have to get, just handling somebody, fecal matter and everything. There's a lot of ways, in my opinion, to get really good results in your gut without having to do a fecal transplant. But some of my patients have done 15 of them, and they saw a result in the first 2, and they just kept doing them, and they kind of got the bump, and that was it. And then other people, like Dr. Perlmutter, I think Perlmutter has an example of a patient with MS who did a fecal transplant and got out of his wheelchair and started dancing around. So it's still a safe, pretty non-invasive, low side effect type procedure. So it's not like even if it doesn't, it's worth taking a look at.
It's hard to find healthy people. This is.
Yeah, only 3%.
Yeah.
2.7%.
Who's got healthy
people?
Yeah, who's a good donor? Well, good point. And as we help our patients get better and everybody improves, then we create more donors that way, right? So here's the natural bug killers. These are the ones I use the most. Again, myriads of different products available on the market. These are the ones I have the most experience with and I've seen be the most well tolerated. Berberine is a fantastic natural antimicrobial. It's a great antibiotic. It also has there's research now on berberine that says it's an MAO inhibitor, so you get like a St. John's wort kind of I don't know if it's as strong as St. John's wort, but you get a nice kind of a mental improvement in your serotonin and neurotransmitter levels with it. Essential oils, when you go to the natural food store and you get like a green cleaner for your house, if you have one at home, go turn the bottle over and look and see what the ingredients are. It'll say active ingredient is thymol, which is thyme oil, right? So thyme, oregano, that's what we use a lot. That's what's in this product. It's oregano, thyme, sage, and lemon balm. Okay, and what Metagenics did is they did hundreds of stool tests and found the blends of the herbs that are going to be the most effective against the most number of different bacteria. So there's just, this has basically 2 bug-killing essential oils in it, and then the Candibactin BR is mainly berberine, but it has a couple other herbs with it as well. MCT oil is great. It's caprylic acid and lauric acid are antiviral, antibacterial, antiparasitic. So I mean, you have these compounds in nature, and MCT oil is just clarified coconut oil. It's basically ghee of a coconut oil variety, right? That's all it is. It's liquid at room temperature. It doesn't turn white and like the coconut oil you have for cooking. You can add it to your tea. You can take it in we usually do about 3 to 4 teaspoons a day when we're going heavy, and then back off 1 teaspoon a day for maintenance. Grapefruit seed extract is kind of like Lysol. That stuff works really well. But again, if you take too much of grapefruit seed extract for months on end, you probably will end up killing good bacteria. And there is such a thing as not having enough good bacteria. Colloidal silver, great for children. I mean, you can spray it on the outside of their body, you can spray it on their throat, you can give it orally. I mean, it's easy to deliver, it's safe. And RNA Labs has a really good product. You can call them. I think all you need to do to order from them is just contact the company. This other company, Supreme Nutrition, they're very high quality herbs as well. I use a lot of Malia and Morinda, which are just, I think that's neem and noni fruit. Neem up here and noni fruit down here. These have been shown, and just in the work that I've done with patients, that those are really great antimicrobials. So with that toolkit, I mean, that's a lot of stuff to look at. I recommend when I work with the patient with SIBO, then we might rotate. We might pick 4 bug killers, not including the MCT oil, so that's like its own category. So we might pick 4 of these and rotate. 2 for 4 days. 4 days later, switch to the other 2, go back and forth. That way you just get a lot of broad spectrum effect. And if you're treating all the other 5 factors, you're treating you're treating the stomach, you're getting the ileocecal valve working, you're working on stomach acid, giving them pancreatic enzymes, making sure bile is working. That's the secret to much better results treating SIBO, right? So that's how we solve this problem. Solving SIBO is, it's a matter of understanding the environment rules the roost. So the bacteria change their behavior based on the environment. We change our behavior based on the environment that we're in. So you get everything working on those 5 factors. You get stomach function, pancreas, gallbladder, fix the hiatal hernia, work on the ileocecal valve. You'll see better results. Thank you so much for watching this video and sharing it with your friends and family. I personally believe, as I'm sure you do as well, that educating ourselves about what it truly means to be healthy is the only way we're going to change healthcare. I have created a website as a resource for you. To take advantage of this information, navigate to www.beyondmthfr.com and take a look around. In addition to blogs and articles I have written, you will find a tab on the menu labeled Protocols. It is a growing list of tools that I use in my office to help support my patients. You will find background information on common health conditions, you will find a detailed supplement protocol, and you will find dietary advice to support the body's natural healing process. You will also have access to order recommended supplements at a discounted rate and have them shipped to your front door. I'm giving you the tools that I use and practice every day to help you overcome health challenges and live a happier, healthier life. I have done my best to give you that information, and you will find it on these protocol pages. If you are looking for more help than simply what supplements should you take or what diet should you follow. I'm encouraging you, I'm inviting you to come to Boise and see me. Let me and my team and my staff take care of you. We have patients coming from all over the country and all over the area on a regular basis, and there's room for you too. Now, if coming all this way to Boise is too big of a commitment, then please pick up the phone or email my office. We can work together from a distance.